Routinely utilizing aromatherapy to improve patients' anxiety in healthcare settings, presented by Olufemilayo Adefalarin, an evidence-based practice presentation at the University of Texas, Rio Grande Valley. Understanding evidence-based practice in nursing. Evidence-based practice is a positive change equals a positive change. It's defined by using the current and best evidence in the decision making of patient care to promote quality care and better outcomes. The three concepts of evidence based practice is clinical expertise, best research, and patient preferences. Motivation for quality improvement initiatives. It shapes the standardization of healthcare practices and policies and protocols. It's proven to improve um, patient outcomes while decreasing patient care costs and helps decrease patient mortality, morbidity, and medical errors. Understanding anxiety in healthcare settings. In this cartoon, you see it says, "Don't worry, I've done this procedure hundreds of times without a single problem." Then again, when you look at it, maybe I'm due. This just really shows that patients go through many different types of anxiety in any different type of healthcare setting, whether it's being hospitalized, going for a procedure, a biopsy, or a routine checkup. To continue to understand anxiety in healthcare settings, we need to understand anxiety. Anxiety is a normal reaction to stress and can be characterized by restlessness, difficulty concentrating, sleep disturbances, fatigue, and tremors. Our patients are usually anxious about post-operative pain, success of a procedure, receiving a medical diagnosis, results from a test, the recovery period, family dynamics, fear of the unknown, and fear of death, or even just fear of negative outcomes. In order, and also to understand anxiety more, there's physiological anxiety responses such as increased heart rate, increased blood pressure, headache, fast breathing, sweating, dry mouth, chest pain, dizziness, diarrhea, shaking. These are some of the things that our body um, physically goes through during the anxiety response, and that response is also seen in our fight or flight response of our body. So the proposed practice change that this presentation is about is the evidence-based practice presentation will present evidence utilizing aromatherapy as a routine intervention in patients that exhibit features of anxiety in healthcare settings. Currently, aromatherapy is an intervention that is not a common practice, but evidence has revealed the therapy to be effective in reducing anxiety. What is aromatherapy? Aromatherapy is the promotion of physical, emotional, and psychological health by using the therapeutic elements of essential oils found in flowers and leaves of plants, stems, and roots. The advantages or benefits of aromatherapy is aroma essential oils achieves balance in patients by calming the mind, body, and spirit. It does not accumulate in the body. It's non-invasive. It's cheap, cost effective, easily applicable. You can put it on easily. It has calming curative effects and alters physiological measures of anxiety that we saw earlier, such as blood pressure, heart rate, and sweating or tremors. Through the research, I found that lavender essential oil is the most common used essential oil. It impacts the amygdala, and in the amygdala, that is the part of our brain that is where our fears and emotions come from. It also has a relaxing and sedative effect. It has a carminative effect, which relaxes smooth muscles. It promotes sleep and quality of sleep. It's the least toxic essential oil. It also has an antidepressant and stress relieving quality. Evidence-based practice search study number one, they examined patients that were undergoing colorectal surgery in the preoperative period effects of lavender aromatherapy massage on anxiety and quality of sleep. And this randomized control study of 6 participants showed that aromatherapy, patients that received aromatherapy the morning of surgery had significant less anxiety. The strength of this study is that it utilized the Spielberg State Anxiety Inventory Scale, and the control group that did not receive aromatherapy, their anxiety actually increased. So this study supports the use of aromatherapy in the anxiety of patients in a healthcare setting. In study number two, they studied the effects of lavender essential oil on sleep quality and anxiety levels of patients in the coronary ICU. Um, and this was a randomized control study of 60 participants, and they used the Beck Anxiety Inventory Scale, which is an instrument to score anxiety, and it's reliable and it's a valid tool. And they saw the results revealed that within the intervention group that received lavender oil, there was a significant difference found in relation to reducing anxiety. Their BAI scores actually decreased significantly. And also, the study found that aromatherapy with lavender oils can decrease anxiety and improve sleep quality in patients. Um, One strength of this is that sleep quality improves, and one can argue that that supports the reduction of anxiety. If you're able to sleep, you're probably not that anxious. And it also used a reliable tool in that Beck Anxiety Inventory Scale. In study number three, they examined the effects of aromatherapy in ICU patients, stress, blood pressure, heart rate, and sleep quality in a non-randomized control study. Again, as we said in previous slides, anxiety um, can be manifested or can be characterized with those physiological markers such as blood pressure. And in the results of this study, aromatherapy with lavender significantly improved perceived stress of patients and enhanced sleep quality. In addition, aromatherapy with lavender demonstrated positive effects of physiological indicators such as a reduction in blood pressure and heart rate. The strength of this study is I found that it didn't specifically mention anxiety as one of the factors tested, but one can see through the results that it also supports the effectiveness of aromatherapy. The methods proven to reduce stress can also be extrapolated to reducing anxiety. And this study was very recent. It took place between July and August 2016. In study number four, they evaluated the effects of lavender aromatherapy on pain, anxiety, and the level of satisfaction associated with peripheral venous cannulation in patients undergoing surgery. The results of this study, this study was a study that comprised of 106 participants, and it was a randomized control study. The results revealed after cannulation, the pain and anxiety scores of patients that received lavender were significantly lower than the control group. The strengths of this study is it demonstrated that there was an increase of blood flow and a decrease in systolic blood pressure with inhalation of lavender essential oils. And one thing about this study is that it had a larger sample size than most of the studies on this topic. In study number five, they examined the effects of music intervention and aromatherapy on reducing anxiety for intensive care unit patients undergoing mechanical ventilation by using patient-reported outcomes and physiological indicators. They also used the visual analog scale and scale for anxiety, which is an instrument to measure anxiety. And this study found that the aromatherapy group was significantly their scores of the VAS for anxiety was significantly more improved than the control group. And in addition, the aromatherapy group had a lower heart rate and slower breathing rate. The strength of this study is that it not only used patient-reported outcomes, but it evaluated physiological indicators such as heart rate, respirations, and systolic blood pressure. And again, it used that visual analog scale. And overall, this study demonstrated that aromatherapy was effective in the anxiety, um, reducing anxiety in patients. In study number six, our last study that we examined, that I examined, but they examined whether the use of two different aromatherapy scents, when compared to a placebo, reduced anxiety in women undergoing image-guided biopsies. And the results of this is the methods used was a randomized placebo-controlled study of 87 women that either received the lavender staplewood, orange peppermint, or they received the placebo. Anxiety in the women was measured by the Spielberg State Anxiety Scale. As a result, there was a statistically significant reduction in the self reported anxiety with the use of lavender sandalwood aromatherapy tabs than the placebo group. And the strength of this also is that it used that Spielberg State anxiety scale to measure anxiety. Recommendations by researchers for potential implementation. Nurses need in-service training programs to be organized to encourage nurses to use aromatherapy within the holistic care of patients. Clinical nurses should learn the skill and when to use it when necessary, and how to use it when necessary. And lavender aromatherapy should be experimented in different and larger samples. Future studies should explore men and women from other diverse cultural and geographical areas. Future research should study more essential oils and explore the different modes of administration. And then the different modes of administration is some studies used a tab and placed it on the patient's clothing, or some studies used an infuser. So it needs to be further studied. Implications for practice is aromatherapy is effective in reducing anxiety among patients. It provides another alternative to treating anxiety. Lavender aromatherapy is a beneficial choice for treating anxiety. It's cost effective in reducing anxiety, better patient outcomes when anxiety is reduced, and it also promotes a therapeutic environment. These are my references, and thank you for listening to my presentation about utilizing aromatherapy in the to reduce patients' anxiety. Thank you.